Ritesh, you are on mute. No.
दीजिए, आप शुरू कर दीजिए.
Are we good?
आप शुरू कर दीजिए.
Ritesh, are you good?
No, आवाज नहीं आ रही.
No.
दीजिए, आप शुरू कर दीजिए.
Namaskar, everyone, and thank you so very much, all of you, for joining this our season 3 session. Ritesh, our current chair, actually is in India right now, and he's having some technical difficulty to welcome you all this our third season, and we are very happy, excited to start this new season. As we all know that we started this initiative almost 4 years ago, and we had our first season with 25 sessions, and second season we started, and that this is the third season. And the theme for this third season is obviously, like, we've been promoting and advocating disease prevention, health promotion, health maintenance, and disease management. This all in all, I think yoga, Ayurveda, nature-based, techniques, how they can help in tackling, healthcare challenges which we all face today. And as we all know, the Ayurveda, which is a science of life, is primarily focuses on individualistic approach, because every human body is unique in itself, and all treatment option should be also unique, as Ayurveda focuses on a body composition, and based upon your body composition, it goes to the root cause of the issues and try to handle those issues. And we all know that we did a MOU with the University Health Network, where we are focusing on integration of Ayurveda and yoga with the in handling and tackling some kind of a chronic disease. And Dr. Paulo, a very warm welcome. Madam Tanuja ji, very, very warm welcome. And Madan ji, Dr. Palvi ji, very warm welcome, and looking forward to this very exciting season starting today onward. A very warm welcome. Over to you.
Thank you. Thank you, Steve ji. Good morning, friends in Toronto, and good evening, friends in India. Welcome to first session of virtual lecture series on integration of Ayurveda and yoga in primary healthcare. Friends, we are running this virtual lecture series from Canada with the support of Canada India Foundation, Toronto, Consulate General of India in Toronto, American Association of Ayurvedic Professionals, USA, Ayurveda Union of Midwest, USA, Association of Ayurveda Academy, UK, European Ayurveda Association, Germany, International Ayurveda League, Mumbai, India, and Tathastu magazine, and our media friends in Europe, UK, Canada, and US. So today's topic is preventative approaches of coronary artery disease. Friends, as you are aware, coronary artery disease is caused by a plaque formation in the wall of arteries of the heart that can cause chest pain, because the plaque can block the artery, block the flow of the blood in the arteries. So it can lead to coronary artery disease. So usually exercises, running, walking, aerobic exercises, we think that it can prevent coronary artery disease. And but recent researches have also shown that Ayurveda and yoga offers holistic approach to coronary artery disease prevention by addressing physical, mental, and emotional factors that contribute to cardiovascular disorders. So today we have two speakers with us. We have Dr. Paul O, a senior scientist at the Kite Research Institute in Toronto. He is working as medical director of UHN's cardiovascular prevention and rehabilitation program. Welcome, Dr. Paulo. And we have great expert of Ayurveda and Yoga, Dr. Tanuja Nesri, with us, who is the director of India's premier institute of Ayurveda in Delhi, All India Institute of Ayurveda. Tanuja ji, welcome to our webinar. So friends, today we shall learn from our experts how preventative approaches of allopathic system of medicine and traditional Ayurvedic medicine can benefit the ailing human beings suffering from coronary artery disease. We have Dr. Madan Thangaveluji with us from UK. He is a genome scientist at Cambridge. Today, he will moderate the technical session. So without wasting any time, I would invite Dr. Madan Thangaveluji to moderate the session. Over to Dr. Madanji.
Harishji, very happy to be here with all of you on the first session of the third in the third series and the first session of the third series. Coronary heart disease is clearly number one killer among diseases, and without taking too much time, I request Paul O to proceed with his talk.
Thank you very much. It is indeed a pleasure to be with you all. Let me just share my slides and we'll get started. I hope you can see that. I believe you can. Satish, thumbs up. You can see the slides?
Yes.
Excellent. Thank you. It is a real honor and privilege to be with you all today. We're very grateful for this opportunity to collaborate. We're tremendously grateful for the support of the Canada India Foundation for our important research endeavors and this exciting collaboration with the All India Institute and with colleagues on this call today. I think we have a shared mission that we all want to improve health for the people whom we interact with, the people whom we serve in our healthcare settings, and the people whom we live with, that we all wish that we are happy and healthy and our families are as well. I've been given the privilege of speaking to the allopathic or Western approach, as Dr. Verma has kindly organized for us. So here's my outline for the next 20 minutes or so, to present deliberately a Western or Canadian approach to cardiovascular disease management, and in particular focusing on what we might term the biomedical model, where we dive more deeply into things like pathophysiology of disease. We'll discuss this with a couple of examples in the coming slides. I work in a rehabilitation environment, and Dr. Verma, you already mentioned that exercise and physical activity are important in that context. And I'll speak a little bit to our approaches and data there that get a little bit more close to the integrated approach that we all wish we had in our day-to-day practices. Touch upon nutritional aspects and psychosocial aspects. And I very much look forward to the discussion today and the work that will unfold over the coming years as we develop opportunities for collaboration amongst our organizations and our programs for improved integrated care. To give you a bit of a setting, that this is the place that I work in Toronto, and I'm very lucky to be able to be in this kind of environment. At the University Health Network in Toronto, we are a conglomeration of large teaching hospitals that include Toronto General, Toronto Western, Princess Margaret Cancer Centre, and the Toronto Rehabilitation Institute. Our rehabilitation site for cardiovascular rehabilitation is sort of unique. You see some of the images here from our actual facility that do not look like a typical hospital. Indeed, it is a rehabilitation environment where we promote exercise and nutrition, and you can see lots of wonderful green spaces and lots of ambient light where we can actually have a kind of a better spiritual experience as well. We see 2,000 people every year. We have seen over 100,000 people since our program's inception in the late 1960s. And this is the place where we do our clinical care and research now, with partly in support with the Canada India Foundation. Let me present to you a story for consideration. My esteemed colleagues have already introduced the notion that heart disease is very common. It's important because it leads to much suffering, the so-called morbidity in medical terms, as well as death or mortality in medical terms. And we all may know somebody who sort of looks like this, a man in his 60s, it could be a woman in her 60s, who has established heart disease. And indeed, this gentleman had a heart attack a couple of years ago. You may also project into here, what if he didn't have a heart attack, but he lives with risk factors like elevated cholesterol values, or high blood pressure, or diabetes, and he may or may not be a smoker as well, to add to his cardiovascular risk. And then we can talk about physical activity patterns and nutritional patterns as well. But this sort of profile on treatment brings to mind a number of approaches from the Western medical perspective. Our views in the West on heart disease is that we focus on diagnosis and interventions and often pharmacologic medications. We think about risk factors that I think are familiar to the audience. I'm sure this is a very learned audience who have heard or experienced that risk factors like high cholesterol and high inflammatory markers like homocysteine or C-reactive protein or having diabetes or high blood pressure, coupled or multiplied by having poor diet and low physical activity, being overweight, particularly with excess fat mass around the middle, and smoking. All of these create an environment where heart disease may develop, those blockages or plaques in the arteries that Dr. Verma spoke to. And if we look inside at a more kind of microvascular level, that we could see that the blood vessels do not work very well, that the blood flow has been impeded, and the tone of these blood vessels is not ideal, which then leads to conditions of atherosclerosis or hardening of the arteries in different parts of the body. In the heart, we call it coronary artery disease. In the legs, we call it peripheral arterial disease. And in the brain, in the neck and the brain, we call it cerebrovascular disease. And it has been stated, this is a worldwide phenomenon. In developed and developing nations, heart disease is one of the major causes of morbidity and mortality. So given this kind of a strong burden of medical conditions or chronic health conditions, we can take different approaches to how we tackle this. And in the West, we tend to focus on the so-called biomedical model of health, where we believe that we are following a scientific process of inquiry, find an issue, develop a question, develop a research methodology to tackle that, do an experiment, learn something, do the analysis, and then repeat, and then implement in clinical care as we move along. We often have a focus around the illness and the biology of the illness. And to our detriment, we may ignore some of the social and psychological aspects of disease. I must say, though, we are learning, and we learn slowly in the West, but we do learn, and there is good recognition that there are social determinants of health, and there are strong mind-body connections. But we have much to learn about this, and this is why collaborations with experts in Ayurvedic medicine and yoga would be so welcome and would enhance our models of care so much together. So thinking of, I will spend a couple minutes though focusing on what do we mean by the biomedical model, just to paint the kind of the scene and the contrast potentially. So we talk about pathophysiology, patho meaning disease. Physiology is the way that the body behaves around that disease or in response to the disease. The big pink circle in the middle represents a cross section of a coronary artery. So if you imagine your heart is about the size of your fist, the blood vessels that feed that heart are around, can kind of be represented by the veins that you might even be able to see on the back of your hand if you make your fist. And if you go inside that vein and look inside, if one had heart disease, that especially heart disease that went quite badly, that this is what the representation would be. That ideally, the opening of this blood vessel would be completely wide open, that there would be nothing inside, actually, it'd just be a blank tube where blood could flow. For this individual, sadly, they've experienced a number of pathophysiologic abnormalities or disease processes, including on the kind of the left-hand side of the slide, this large pink crescent moon shaped abnormality here represents a large deposit of cholesterol, or lipids is another term for this. This is something that builds up in decades. You know, we see it in people living in Western societies, but it is known as a known phenomenon all across the world where there's cholesterol deposition. There is thickening and dysfunction of the entire artery. So normally in our youth, blood vessels are very elastic and contract and relax and pump blood through beautifully. These become very stiff as we age and don't transmit the blood particularly well, leading to more abnormalities. The other significant problem for this individual that I think you can appreciate is this dark red blob in the middle. And indeed, this is the thing, the pathway that led to blockage of this artery entirely, leading to a fatal heart attack for this individual, sadly. This is a collection of blood clotting, a number of blood kind of cells that all came together and clotted up. So this is the medical kind of approach. This is where things start. If we, in the Western kind of approach, that we look at disease in this way, that there are physical abnormalities, we try to understand them and then try to get down to more the cellular or microscopic, mechanistic kind of level of what's going on here. I'll go through this with a couple of examples just so that we can kind of get on the same page. And then this will hopefully be a nice platform for Dr. Nassari to say, you know, there's other ways of thinking about this apart from the Western pathophysiologic approach. So if I focus on that red blob in the middle, that thrombus, it is composed of blood cells. And of course, all of us have blood cells that float around very innocently, and they have amazing structure and function and keep us going very, very well. If you look with a microscope inside the bone marrow of an individual, and then you do some fancy staining of those cells, you can see this amazing kind of architecture. The world within has things like these beautiful red kind of donut-shaped cells that are red blood cells. They float around, they have iron in them, they capture oxygen from the lungs, and they transmit it through all of our body. And this is a marvelous system where we can bring oxygen to essential parts of our body so they can function. We also have, in this case, a kind of a purplish looking cell that represents the white cell that has its amazing function of fighting off infections. And during times of our recent pandemics and through our winter seasons where infections may come on, these white cells are charged up and fight off infections. The other kind of interesting cells that enter into this part of the story of heart disease are these yellowish ones that are called platelets. We have about 1 trillion of them in our body. They float around, they live for about 7 days, and their sole function in life is to stick to things. And that's where life gets interesting. Because when a platelet gets active, they actually transform from kind of innocent little discs to something that becomes much more three-dimensional in nature. They stick out little hands. In a chemical sense, these things are called glycoprotein 2B3A receptors. And you can see that these hands come close to each other. In fact, in a very romantic sense, they start to hold hands together and they develop cross-linking, which can lead then to clumping within that artery wall that now is so familiar to you. Remember, this looks like a lipid kind of core. This is the atherosclerosis. But on the surface of all of this, we can start to have platelets that stick to this. And that's the first inciting event that then may lead to more clumping of platelets. And we do things in medicine, Western medicine, like finding narrowed arteries, putting a balloon on a wire across that, stretching that artery open and leaving behind a piece of metal. This is called a percutaneous coronary intervention or an angioplasty. But you can see as part of that kind of intervention that has marvelous science behind it, we may be actually causing some trauma inside the blood vessel that leads to activation of these kinds of blood cells. So if we know that that's going on, there's the potential to develop that red thrombus blood clot. we can, in a sciencey sort of sense, get into those cells and understand what's going on with the machinery that makes blood cells or platelets so sticky. And you can develop the pathways that tell a platelet to get excited, to stick its fingers out, and then to start to stick together. And once we understand that there are kind of these chemical amplification pathways, like this one called cyclooxygenase that lives inside the platelet, tells the platelet, get your machinery ramped up, start to stick your fingers up and start to get close to other platelets. If we understand that that's an important pathway signal that we can understand, but then we can also think about that could be a target where we can develop a medication to go address that issue. And we know that the simple medication called aspirin, that's actually where it works. And that's how it treats a heart attack. That's also how it prevents a heart attack. Platelets are very excitable, though, and because that they are so primed up to do their singular job of sticking to things, that they have multiple other signals that lead to platelets getting excited, linking together, and sticking in places. So if we understand what some of these other chemical signals might be, we can develop other medications that might block all of this. So this is the interesting science of how we can actually think about what's going on from a pathophysiologic sense, and then develop Western medical approaches to address those things. And then, very importantly, study this in large research programs. And this, for instance, is a summation of about 100 years of research into aspirin, where hundreds of thousands and millions of people, in fact, have been treated in clinical studies. And you'll see here, this represents the percentage of people that might have a bad problem, like a serious vascular event, a stroke, or a coronary event. The orange bar represents people who receive aspirin, and the pink bar represents people who receive placebo. And you can see that the people on aspirin enjoy some benefit here. It's not absolute. We don't take away everything, but it is a significant reduction. So this is the cascade of biomedical science in terms of finding an issue, developing some understanding of what's going on, kind of finding a targeted therapy that might address the question, doing the research study, and then getting this into clinical care. And then we repeat and do the cycles over and over again to do further interventions and see if we can do something better. Let me turn to another kind of pathway, and I'm not going to be exhaustive here, given the time we have, but I'll give you another example, for instance, from our kind of views on cholesterol, the pathophysiology of cholesterol. So if we think of that crescent moon that's on the left-hand side of that coronary artery, how do we get there? Well, we know in Western societies, we eat cholesterol. We can eat cholesterol liberally. Some of us are more thoughtful about that and have more plants in our diet and can certainly reduce cholesterol intake. But we also recognize that cholesterol is produced to a large extent inside of us as well, in particular in this organ called the liver. The liver is responsible for producing all kinds of chemicals and has an amazing set of factories inside of it that produce various kinds of proteins. The cholesterol factories take small building blocks, and these are the molecules that it starts with, and starts to attach them together to build a more complex molecule here called cholesterol. As that pathway moves along, if we eat as much cholesterol as we can, and we produce as much cholesterol as we can, the net effect, certainly in Western societies, is that we have too much cholesterol floating around in our systems, and then it starts to look to places to deposit. And in this case, the coronary artery that now we're looking in on a kind of a three-dimensional longitudinal view, this is where the cholesterol goes. This clearly is not a nice pathway for us to be in, but it seems that most people in Western society, this is a fact of living in some ways. Well, we could, if we understand this pathway, maybe we can develop methodologies to interrupt what's actually going on. And in this case, the cholesterol pathway involves some important rate limiting steps, or key factories that I like to think about it as. One of these factories is called HMG-CoA reductase. It's got a ridiculously long name, but it's one of the key steps in this sort of production of it. We know that ideally we would like our cholesterol values to be low. This is the LDL, low density lipoprotein target that we endorse in Canada, and most international societies are here or similar to it. But the idea is that most people in Canada have a cholesterol value, LDL cholesterol of 2.5 or above. So we're about 30 or 40 or 50% higher than we need to be. So if we know that this is the pathway, why don't we think about a therapy that can actually block that pathway? And in this case, this is why these medications that are called statin drugs, rosuvastatin, simvastatin, atorvastatin, etc., are so commonly used in the prevention and treatment of heart disease, is because they get to this story about cholesterol and actually block this. If we can do that, what we actually change the balance of is, instead of depositing cholesterol in our arteries, if we can block the production of cholesterol, we actually start to remove this cholesterol and actually start to return it to the liver. Other newer therapies also kind of exploit this mechanism of enhancing the recycling of cholesterol. And there are exciting new injectable therapies that are being introduced, some that you only need to take twice per year, for instance, that can actually change the way that the liver handles all of this. But this starts with a question. I have heart disease. I have cholesterol problems. Can I understand what the pathway looks like? Can I understand the steps that are involved? Then can I develop therapies to do that, do it in research, prove that it actually works, and then implement this in clinical care? This is the story. But this leads to a lot of complexity in Western medicine, where if we look at the case that we talked about, the modern medical approach looks something like this, which is very challenging for the typical person that we see. That we say, because the blood sticking problem, because of the thrombus formation, you need to take an aspirin. But in modern studies, we say you also need a second one or a third agent to block the blood. You need or block the blood sticking, I should say. To address cholesterol problems, you need the statin medication, but you may need one or two or three more things. We didn't talk about blood pressure today, but there are standard blood pressure drugs that we might use. And many people need 1, 2, or 3 different kinds of drugs there. And for diabetes, which affects 5 to 10% of the Canadian population, more so for people living with heart disease, that we have multiple medications that may be used for that individual as well. So this is daunting, isn't it? The Western medical approach leads people to say, hey, you've got heart disease, and here's a dozen different medicines that you need to take. It may not be that friendly. Instead, we do embrace that there might be alternate pathways that we can explore. And I will be done in a couple minutes here. That we understand that we want to do more than just give people pills, even though it seems that sometimes that's what Western medicine is about. We do appreciate in our area, for instance, about cardiac rehabilitation, where we do want to achieve better physical, mental, and social function so that people can get back into community. That we do rely on structured exercise programs. And as Dr. Verma said, that ours is Western style of exercise by and large: walk on treadmills, jog, cycle, lift weights. We do promote good, healthy diets, but again, it's going to be different than in your context and reality in Indian culture. We believe in behavioral engagement. That is, that people have reached the point of heart disease because they've been left to their own devices by and large. But instead, we need to get to a health orientation where people can become the managers of their own health. And then we provide a lot of education along the way so they can actually be successful. Again, in the Western medical sense, we know that if we provide exercise programming, that people will do better. In this analysis from our own program of 30 years of data, what is represented here are different levels of fitness for people being in our program. And if you have low fitness versus high fitness, the risk of dying over a period of 30 years is substantially different. So we promote people to get to higher levels of fitness by doing regular exercise programs most days of the week. And indeed, the cardiac societies in North America have adopted this. And the American Heart Association, for instance, has come out and said that you need to assess fitness as a vital sign in part of your routine medical care, because this recognition that if you have low fitness, your risk of death is high. If you have high fitness, your risk of death is substantially reduced. We can make this even better, can't we? And this study that was published in the American Journal of the American Cardiology spoke to the yoga-based cardiac rehab after acute myocardial infarctions, that can say, not only might you do your traditional Western kinds of approaches, but if you actually introduce yoga in a very structured, scientific way, that we can improve self-rated health and we can get back to activities. The study wasn't quite large enough to show us a difference in heart attack or stroke in the future, but is certainly inspirational to us. And we're very proud and privileged and honored to be able to collaborate with the Canada India Foundation, partner very, very closely together, and just on Friday celebrate the International Day of Yoga together, where we were able to have a wonderful gathering, a wonderful practice with Guru, and this was so much appreciated. And everyone who attended said this must be part of the cardiac rehab program going forward. And indeed, that's what we feel as well. Perhaps I'll end there given the time. I'm going to stop sharing, but just say that this is such a wonderful opportunity for us to kick off this third series, but also very importantly for us in the program to think about how we're going to do more work collaboratively together. Thank you very much.
Excellent.
Thank you. Thank you very much, Dr. O. We take the opportunity to now hear from Dr. Tanuja Nesri about what she's heard. Tanuja.
Can you hear me?
Yes.
Can you hear me?
Yes, we do.
Thank you very much, Dr. Madan Thengavelu and Dr. Paul. I think you have set the ball. You have just opening remarks. And even though you spoke about the conventional medicine, how the coronary artery diseases and how the plaque is being formed, what is the cholesterol and why this thrombolysis and the standing story. But I think at the end, what I understood is you spoke about the Ayurveda and my role has been made very easy. And for that, I'm really thankful to you. And I'm really thankful to Canada India Foundation. Feel honored that because of the initiation of Satish Thakkarji, Ritesh Malikji, and Dr. Verma, and all other friends who have joined, I can see Dr. Patankar and Dr. Ashlesha and everyone. Last year, we could sign the MOU with Canada India Foundation and University Health Network. And I had an opportunity and honor to be at UHN. It's a very a unique opportunity we had, and we had a discussion and the presentation and trying to explore the opportunity where we can collaborate and create the evidence-based practices through this traditional wisdom of Ayurveda. As it is said that I would just focus on what is the approach of Ayurveda in understanding coronary artery disease and how we understand the plaque and what are the unique approach, the different approach when we say that we want to create the harmony, we want to have the integration, but we have to really understand whether because we say that the Ayurveda principal theory and applications, and when we try to understand conventional medicine, it is like apple is compared with the oranges, and we cannot have the taste of at both the things and at one time. So we understand what is the unique approach and where we can complement each other and bridge the gap so that we can bring out the better outcome, which is a patient-centric, person-centric. And before that, I just would like to say what is Ayurveda. Ayurveda is a knowledge system of health and happiness. So it is a prevention is better than the cure, and journey of illness starts from the illness to wellness. But as it aims as a life knowledge system of health and happiness, so the journey is from illness to wellness to happiness. So where we at each and every point for the prevention, promotion, and the therapeutic aspects also, the entire aim is to re-establish the harmony and to provide holistic health and well-being and give him its own happiness as well. So coming to the when this topic, the discussion itself, the topic which has been given to me, we are discussing about the coronary artery diseases, so vascular diseases. So we say that the Ayurveda is, the prevention is the strength of Ayurveda, because we say that swasthasya swasthya rakshanam aturasya vikara parimokshana. So just to prevent everything before it is fully manifested, and the reversal from the Purva Rupa before it manifestation is the strength of Ayurveda. So in preventive cardiology, prevention is the better, and that is the strength of Ayurveda. And even if the disease is full blown, then the holistic management through Panchakarma, diet, medicine, lifestyle change, and yoga and medicine. So that is the holistic management coupled with conventional investigation and outcome measure, again is the strength of Ayurveda. So in the topic which is given to me, we say that how the disease is manifested. So the Hruday, that is a heart, consider Ayurveda as a, this is considered under the umbrella as a Hruday rog, Rudrog. Hruday is a heart, and the disease is a roga, so Rudrog. But again, it is also considered as a gulma, because it is originated to the alimentary canal, imbalance in the digestive system, and the shofa. These are the three conditions which resemble, and we consider all the measures which we can prevent this condition before it manifests, and as a full disease is manifested. And when we say that rogam adau parikshet tato anantaram aushadam. So understand the disease first, pathophysiology, etiopathogenesis first, before we understand the principle of management. So what is Hruday? And the Hruday is the seat. We understand according to Ayurveda. It's a seat of manas, that is the mind. So anything which are the stressors and the mental affliction that directly affects the heart. When we say that
Harishi,
aggravates the pathophysiology.
we have a
The
problem.
second, it is said that it is a seat of rasa vaha srotas. The first dhatu, that is the tissue. Ayurveda understands entire physiology as a dosha, dhatu, mala, and srotas. So this is the disease of vitiation of rasa dhatu. So the first nutrient part, if it is deranged, so what is the pathophysiology is said that maybe our Ayurvedic friends, when they will appreciate most, because this itself, the approach is not lipocentric. It is not the disease as a coronary artery, but how the pathophysiology is aggravated at the level of coronary artery. We understand the circulating nutrient, that is rasavaha strotas, and the rasa dhatu, if that is vitiated, that is heavy, that is guru. We say that because of the ama toxins, it is vitiated, then that leads to formation of plaque, more cholesterol, and that leads to further the blockage and narrowing of the lumen. So exactly the same pathophysiology as you mentioned, and it was very easy for us to understand. It says thousands of years back, Acharya Charak mentioned that Dushayitva rasam dosha viguna rudayam gataha. So Dushayitva, that is a vitiation. Rasa, that is the first tissue. Rasa dhatu, when it is vitiated along with the doshas, that is ama and rasa dosha, when it circulates through the hruday, that is a heart, because all the nutrients, the blood and the lymph, that circulates through the hruday, and that is a heart. And when it is the function disorder, no, it is the gata. So the one, the heart, which is already weakened, vitiated. So the heart, the organic, the muscle and the artery, it is already the weak because of the excessive wrong diet and the lifestyle. Then the seed that the dosha dussa samurchana, the pathophysiology is manifested, and then it is a coronary vascular disease that is manifested with many other conditions. So if we understand the three culprits, one is a Agni, digestive capacity. If that is wrong, Agni is hampered, Ama is more, Rasa is vitiated, and that circulation is persistent, continuous. That affects the Marma as a Hruday, and that is how the pathophysiology start. So what are the causative factors? What happens? So the Rasa, the first nutrient part, how it is vitiated, it's very interestingly, it is said that there are dietary factors. When the excessive heavy guru shita ati shita, so the factor says that if it is too heavy, like if we take red meat, too heavy, the cheese and the butter and the cake and the pastries and the fine wheat. So all heavy things if we consume, and the all cold things, all freezed water, ice creams and all continuously take. And very importantly, ati shitam, ati matram, excessive, whatever is my digestive capacity, if I take excess, that is excessive taking, that also forms, that vitiates rasa dhatu and forms ama. And samashnatam, that is also very important. If I take full meal, I'm complete. But someone says that take something after that as a icing on the cake. So after that, if we consume the dessert, so it is beyond the capacity once it is a food, but just as a party manner. If we take on consuming something extra, that affects vitiation of rasa. That we really have to understand. So the diet, the wrong dietary habit is the main thing, the first initiation, because Hruday, heart, it is there, heart disease, but it starts in the stomach, Agni. So that this Hruday rog starts with the level of digestion. If the digestion metabolism is hampered, that is the first step we have to understand. And then second is the mental, psychosomatic is very important. The mental, because the rasa vahini dushyanti chintanam ati chintanam. So excessive thinking, excessive emotionally worrying, depression, anxiety, and continuous brooding, that vitiates the rasa. When we say that there is everything is perfectly healthy, but if I am under the very stressful condition, my digestion is hampered. That is the first stress, because all of us, we are living in the stressful condition, and that is the main cause of Rud Rog according to Ayurveda. So that vitiates the rasa srotas, and that affects the Hruday, and that's why the mental disorders, the excessive stress is the main cause. The one cause which may, etiological factor, which may be overlooked, but that is very, very important, Ayurveda has mentioned, that is Vega Vidharan. Those the natural urges, if we withhold those natural urges like defecation, urination, so those natural urges have to be evacuated. If everyone, we say that Ayurveda Dinacharya, daily healthy routine says that once in a day we have to defecate early morning. Brahme murde uttishte jirna jirnan nirupayam. So if you do not defecate, pass the stool, past the bowels are not good, the constipation, we say that the dosha vata vilomagati. So that also is the main cause of having ama and vitiation. So that is also very important. Abhighata, and in diet, more importantly, astringent, kashai, that is too much taking coffee, tea, betel nut, and the alcohol and the addictions, that is also another cause of having these conditions. This is specifically mentioned under the condition of Rudroga. And maybe these were the unique things which I wanted to say, that the how it is manifested. So we have to understand the cause and the samprapti, that is pathophysiology, etiopathogenesis, so that we can really consider before the disease is there manifested, the prevention is the better than the cure. So what are the preventive measures have to be taken according to, then before we go for the plan of management. So in the prevention, healthy lifestyle and the healthy diet, we say that ahara, vihara, achar, and rasayan. That means ahar is a diet. So which is the good diet that prevents the vitiation of rasa and prevents the healthy the heart, that the healthy heart and the organic conditions of the heart, and maintains the rasa dushti and maintains agni at the optimum. So the good diet is said that it should be of 6 tastes and 4 forms. But what is more important is, when it is not important what you eat, maybe you should have the light, unctuous, and vatanuloman, that is snigdha, lagu, and vatanuloman. But what is more important is, when you eat, what quantity you eat, that is what time you eat, that is kala, and matra, that is quantity, is also very, very important. And we say that suraj ke saath chalo, so that is eat according to the eat, walk, live according to the sun, because solar energy is optimum and the metabolism is optimum. And we say that we are the miniature creature of the universe. So when there is a solar energy, kinetic energy is optimum, we should wake up early in the morning. Our breakfast, lunch, and dinner should be in between sunrise and sunset, so that it is our digestion and metabolism, agni stimulation, deepen is optimum. That is the time when we should eat. No, we should not eat late night, because that becomes tamasic and guru, and that is the main cause of vitiation, creation of ama and hamper of agni. So now when we say that timing, that is sunrise to sunset, but one should very importantly remember that between 2 meals, like lunch, breakfast, lunch, then there should be 3 hours minimum gap, because whatever we take, that should be digested completely, and we should feel hungry, appetite should be there. When we should eat, only when we feel hungry. That is very important. That we not form ama. So if it is 8-9 breakfast morning, then lunch to dinner should not be more than 6 hours. We should not be like 12, then 7 to 8 should be dinner, and in between light midday meal. If we follow these practices, I think we can prevent everything. Because everything starts with rogaha sarvepi mandagni. It starts with manda agni, hamper of agni. Your digestion and metabolism, agni is hampered, ama is produced, that vitiates with first nutrient tissue, that is rasava, and that is how it starts with the heart disease and coronary blockage of the artery. So that is one thing. And then how much one should eat? Matra. So till you feel completely full, you should not eat completely full. Something you should feel that I can eat something. So that is the time where you should stop. And the meal should have the liquid, solid, semi-solid, and hard. That is a general principle. And now in diet, because even lot of studies have been done, even in the Western conventional medicine also, that is dietary approach to stop hypertension, the DASH diet. And as we know that the Dean Ornish diet, and it said, as you showed, very beautiful a picture of the vegetables, low fat content, like the food having the low fat, high fiber, high protein, but the no animal, lean meat, less animal, and limited simple carbohydrates and sugar maintains stable blood, which maintains the stable blood sugar level, and overall lifestyle approach. Like it should be the vegetables, nuts, good ghee, that is cow's ghee, not fat like the butter and the cheese, that should be avoided. It should be the milk, but the cow milk also various dietary approach, and we say that let food be your medicine. If we correct the diet, I think we can win the half of the battle. And it is again the red gram, horse gram, green gram, moat, that is makushta in Ayurveda. It is a vigna. And then chickpea also can be taken as a protein, vegetable protein, the cereals, because last year, 23 was the International Millet Year. And that is the exact, it's a very good food substitute. Any form of the millets, like the banyan millet, sorghum, finger millet, whatever the millet which are, because that is high fiber, low glycemic index, high protein, and with rich in the micronutrients can be taken. And in the fruits, Ayurveda says that amla rasa, that is the sour, all the berries and the sour fruits are really good, that is a cardioprotective. And we say that the Rudayaya Hitam, which is good for the mind and also for the heart. And pomegranate is very good. And the lemon, oranges, all sort of berries are really very good. And wood apple, I don't know whether it is available, but Ayurveda again says that amalaki, that is the Indian gooseberry, amla is also very good. And the three fruits, like three Amla, Haritaki, and Bibitaki can be taken every day. And instead of taking milk, the buttermilk, which is sour, and also anuloman, which is really good, and it is a hypolipidemic because it has a lekhana, dipana pachana. So buttermilk with the cumin seed is the best, and one should be very cautious and very careful about selecting the oil, what type of oil it is used, because anything which is oily also increases more cholesterol, more plaque. So Ayurveda says that the sesame oil or olive oil, which has both monosaturated and all balanced fatty acids, should be taken. And the oil should, how much oil one should take? Not more than 3 teaspoonful complete in a day. I think that is the ideal for keeping your heart healthy. And teaspoon of cow's ghee is good. We understand. Still, it should be completely avoided because that is one which is a causes more ama. And I will just complete fast. But the spices, which are very much indicated, one should have a research study. And as we are discussing, even Satishji and Dr. O, that we can really initiate this is, and Dr. Verma, we can initiate the study on Haritaki, that is Terminalia tubula, because it is says that pranada doshe, Haritaki sampravartini. So it is malapachan, that is digest all the ama, all the plaque disintegrates. And it is also hypolipidemic and sroto vishidani. So cleansing action it has. So this can be the one single herb can be taken. And the second combination is turmeric, that is haldi. And Ayurveda says that meheshu nishamalaki, that means turmeric and amalaki. If we take together at night with warm water, lukewarm water itself is a cleansing and lekana. If we take two things together, turmeric and amla together, that itself is very good hypolipidemic, and it is the best cleansing. And the research has been done, and lot of research is still to be done. So there are again two good things everyone can take. The second dietary supplement can everyone must have, and in India we have that in the seasoning is asafoetida, hing. Hing is a asafoetida, and we have the medicine as a hingvashtak churna, Bituttar hingvadi yog, hingvadi gruta. Dr. Verma also will agree to me that asafoetida is the one thing which one should consume in the diet, and as a medicine also we have lot of medicines. Then the fourth important spice, which is very important, is uh, ajwayan, ajovan, ajwayan, because yavani and ajmoda is the one good for the circulation, and that is the chedana, and that breaks the even thrombus also, and the lipids also, that breaks the plaque. So this is ajmoda, that is ajmoda Tachysphermum ammi, then cumin seeds. All these spices are very important supplement, which we really don't recommend as a tamasic, but the garlic is also very good. And the lemon water, like early morning, if you wake up and take the warm lemon water with the pinch of rock salt and this ginger, that itself is the best medicine. Even the study can be done, one group with lemon water and ginger, which is a very simple, and the other group remain as it is. That itself good intervention will make the difference, because that blocks, that prevents the blockage. So these are very simple but effective interventions, dietary supplement we can have. And as a therapeutic measure, the gugulu, different forms of gugulu like triphala gugul, there are pushkar mool, there punarnava gugulu. These are the medicines which can be used. There are arjuna. The question is that Arjuna, in which form you can use, because Arjuna Rishta can be used because itself is a astringent. So we have to avoid all the astringent things. And I think if we plan the holistic, because what I understand at All India Institute of Ayurveda, we have a database of 2.4 million patients, 26 lakh patients, and we have a separate coronary artery preventive cardiology unit where CT angiograph is done pre and the post. And we have used Manjishta and these simple interventions where we can showcase pre and post. And we have those cases and the database. And at our MD, PhD and the research maker, we have the evidence-based data and the practice-based evidence also. So I look forward.
Dr. Thank you.
Thank you.
Thank you, Dr. Nesri, for elaborating on aspects related to nutrition. I'd share the floor with Pallavi ji for questions.
Thank you, Dr. Madan. Thank you very much. It was a fantastic talk by Dr. Paul. We are very fortunate, Dr. Paul, to have you here today as our third inaugural session, third season session. And you have very beautifully explained, especially the platelets romancing, that was wonderful way of explaining things, And Dr. Tanuja Nesri also mentioned about some very important aspect is that virtually you divide your stomach in 4 parts, have 2 parts of solid, 1 portion liquid, and 1 portion should be vacant. If we follow these basic simple rules, I'm sure we'll go a long way. And I just want to mention one thing is about the miraculous drug that is Haritki. It is Terminalia chebula. And our lifestyles have been so haphazard these days. And the heart is the seat of emotion. and the consciousness, that is Chetana or Bhavana, what we call it. And the moment there is some humiliation, it is the heart which is affected and our lifestyle precipitates it. Thank you. Thank you, Dr. Madan.
Thank you. Thank you, Pallaviji. Together we have come to a allocated time for the webinar. The Pratibha Shah, I see Dr. Shah here. Pratibhaji, please.
So just one quick comment. Thank you, Dr. Paul. Thank you, Dr. Tanuja. Wonderful perspectives from both sides. Really delightful to hear both sides of care. I think today we have had a wonderful opportunity to focus on preventative cardiology from Ayurveda perspective. I think I would love to have a part 2 where we can focus on some data, some details on the therapeutic cardiology in Ayurveda, because I think that is where the challenge lies, because people know what is good, but the challenge is, are they able to follow? So while we try to bring in preventative cardiology for reducing the incidence of cardiac diseases in the future, how do we address, or how do we try and bring about an integrative approach in the therapeutic side, the treatment side, for the big chunk of the population that already have developed some kind of cardiac disease, inflammation, hypercholesteremia, or they have other risk factors like diabetes or obesity. Yeah.
Thank you.
Thank you.
Thank you, Dr. Shah. What is becoming clear is the variation that we find in the differences between the two systems. And I wonder if someone wanted to address that, or I'd leave that to Harish ji.
Yeah.
Harish.
Thank you, Dr. Madanji. Dr. Tanuja ji, you have explained wonderfully. And I already discussed the concept of doing some clinical trial on Nisha Amlaki with Dr. Paul. And he principally agreed. And now in this meeting, if you can slightly explain, can we use Nisha Amlaki, the combination of turmeric and amla, as a supplement along with the allopathic drugs, what the Dr. Paul mentioned, a routine prescription with statins, hypertensive, anti-diabetic to the patients having metabolic disorder or the conditions like diabetes, blood pressure, high blood pressure, cholesterol, and obesity. So can we use this Nisha Amlaki along with these medicines as supplement?
Of course, we can use, because haldi, turmeric is a dietary ingredient. We cannot say that it is like a additional medicine or the drug. So drug to herb interaction does not happen. That is our experience. We have database of more than 30,000 patients, which we are giving. As and to each and every patient, we recommend to have more, depending on their body type, that is Prakruti. So Nisha and Amalaki, that is Avla, because we say that it is a Swastha Hita, daily herbal health promoter. Everyone can take it. So Avla and Haritaki, we consider as a dietary substances. So we can consider this as a supplement. So the timing of taking two medicines like cannot be taken together. Minimum half an hour gap should be there considering the PDPK. So maybe we can recommend morning or evening, both Avla and Haldi, Nisha Malki, and then we can follow the same conventional medication. I think one group can follow this and the other, this can very well be done with warm water.
Actually, Dr. Tanujaji, the challenge we are facing is in Canada, there are a lot of patients now, those who are not responding to allopathic drugs. Like people are taking 1, 2, even 3 hypoglycemic drugs, still their number, their blood sugar level is up more than 10, more than 15. And this is a biggest medical challenge the medical fraternity is facing. And on the same side, even by giving too much statin, the highest dosage of statin, sometimes the cholesterol is not controlled. So if we can fill this gap with the addition of Nisha Amlaki, then it will be a wonderful thing for everybody. So
Yeah, and everyone can take that. And even Triphala is also good, good suggestion. Maybe good upon another option.
okay.
Triphala. Nishamalki is
Great.
also good.
So Dr. Paul, if you want to add anything into this, so that we can in few weeks we should plan our research project as we discussed in our last meeting, that we should now start the research project where UHN can make a protocol, and we have a good base in India where we can have thousands of patients. And already Dr. Nesri has said in her institution this cardiology unit is already there. So, Dr. Paul,
Yeah.
over to you.
Yeah, thank you very much for the presentation, Dr. Nassari, and the commentary. You know, I feel like this is the start of a longer conversation that we very much look forward to, Dr. Madden. This was, I guess, the chapter one where we kind of lay some groundwork. I think, you know, I was deliberately not presenting areas of overlap, but indeed there are many areas of overlap already from Western medicine and traditional Ayurveda, and I'm glad that there are. You know, the embracing of psychosocial health and the importance of diet, and I think the unique perspectives that Dr. Nassari brings to the understanding of why we might approach things in a certain way. Why do we promote plant-based diets? Why more chickpeas? Why olive oil? These sorts of things. I think the insights are fantastic. And yes, the research opportunities, there are many. And we look forward to those conversations, perhaps in a different venue where we have the time to dive into products and protocols and populations. There's at least 3 Ps. So I think this is a very exciting place for us to launch from, and I really appreciate this opportunity to have this conversation today. Thank you.
Thank you. Thank you. Pratibha Shah.
Thank you. Very quickly, I was just, I would be very interested in the discussion on what can be the integrative addition from Ayurveda side, because I was just thinking that Nisha Amlaki is wonderful. However, because turmeric does enhance the effect of blood thinners, I'm just wondering if that needs to be borne in mind. And I was thinking about Trifla and Arjuna as more, directly conflicting kind of herbs or formulations, because Arjuna is cardioprotective, and that cascades into many benefits into the inflammatory and other changes in the heart. So just a quick note on that.
Thank you. I think we, Pallavi.
Yeah,
Pallavi,
quickly. Yeah. Just a quick comment, Dr. Madan. Thank you. There are a few herbs which are totally dedicated to the as a cardiac tonic, Hriday, which Uttejak, that is Arjuna, Karpur, that is camphor, Rutpatri is digoxin, from where we derive the thing digoxin, and Tharuni, that is rose, gulab, and even betel nut, for a matter of fact, has been integrated in the cardiac drugs, Hriday Rog helpers, like promoters to help cardiac health. So there are these 4 or 5 dravyas, which are plants, herbs mentioned in our Dravya Gun Samhita, which help the heart health. And another thing I would like to say to Dr. Paul is that as heart is the seat of emotion and our consciousness, yoga, which brings a very balanced and a stable state between the mind, body, and our consciousness, it brings about a clarity in what we should do, what we should eat, and how we should behave socially, physically, emotionally, and spiritually. Thank you, Dr. Madan.
Thank you. Tanuja.
Yeah, quickly, I will not take much time, but I was just about to concur the what Dr. Patanker mentioned. So in the yoga, specifically the pranayam, the breathing practices and the meditation, because that calms down the mind and the stabilizes the mind. But the research tells that the omkara and the brahmari has the really very good effect for as a cardiotonic. So there are a lot of research is being conducted on the pranayam and the meditation breathing practices, even in India, and the various organizations collaborative, we are also working together. So maybe these are the simple interventions we can suggest, and we can do, anyone can follow it.
Thank you, Tanuja. I don't know how we are for time. If Dr. Harish Verma can mention.
So time is over already, Madanji. So I think I'll ask Dr. Palvi for the vote of thanks.
Thanks. Thank you. Thank you.
Do we have Ritesh ji here?
And I think he has left.
Okay. All right. So it's been wonderful to have you all today for on a Sunday morning and Sunday evening for the people in India. Dr. Paul O and Dr. Tanuja Nesri, you all have been so very good today in conveying the message for a good cardiac health. I'm totally thankful to Mr. Satish Thakurji for being such a big support right from the beginning, from season 1 and initiating season 3. Thank you very much. And Dr. Harish Verma, Dr. Madan, Dr. Pratibha, Ashlesha ji for being here today with us and enriching this session. I thank Canada India Foundation for supporting this integration of Ayurveda, yoga, and primary health care on various topics. Canadian College of Ayurveda and Yoga, Tatastu, who have been there with us right from the beginning, Consulate General of India, Toronto in Canada, American Association of Ayurvedic Professionals, European Ayurveda Association, Germany, European Ayurvedic Association from UK, Association Ayurvedic Academy, Ayurvedic Union of Midwest Chicago, and International Ayurvedic League India. So it has been wonderful to have you all here. I am very thankful to the audience also for attending this session today. The next session will be on 28th of